The next topic is colon cancer. I request Dr. Samrat to proceed the session with the topic.
Colorectal cancer or colon cancer. It is one of the favorite topic of mine because this cancer, if someone is having trouble in the GI system, suppose sometime what happen if we take a colon cancer, it is a part of the bowel, large intestine, which is the end part where cancer will develop. These are the cancer which is very difficult to detect early. In fact, the most common symptom of colon cancer, early colon cancer, is no symptom. It doesn't come with any kind of symptom. When it comes to early cancer, it comes with a vague symptom such as patient will come in the OPD. मुझे पाइल्स है, क्यों पाइल्स है? खून आ रहा है, मोशन में खून आ रहा है. So person will label that blood in the stool because of the piles, and if it is a piles, he will start treating the piles. But the people forget that the blood in the stool is not always piles. It can be a cancer. And surprisingly, last 15 days back, one of our person only came, 38-year age. He came for treatment of the piles. Just we put a finger and to see that on the table, it turns to be cancer. We are lucky that we diagnose him in an early phase. But if we go with that piles treatment, blood आ रहा है और वहां से bleeding हो रहा है, piles का treatment कर दिया, we will lose the window where we can detect the cancer in early phase, and it will come in next few months where we can't treat the person. So there is no symptom or vague symptom, and many of the colorectal cancer comes with a constipation, altered bowel habit. Person, uska bhi hai, 1 month prior I had a patient who come, the lady of 50-year age who visited for the constipation and done the scan, turns to be a cancer. So any GI symptoms, specifically after 40 or 50, if you are having blood in the stool or constipation, these are early signs which is showing that something is wrong happening, like a cancer may be there. Chances may be very less, but cancer may be there. We should not neglect. This is a very important quote about the colorectal cancer. In fact, in a whole body, some cancer which can happen if suppose God tells the cancer is going to happen. Colorectal is a one which is very good cancer because it can be prevented, it can be cured, and it can be treated. Even we can completely remove the cancer in early stage. And for that reason only in Western world they started. 50वीं सालगिरह है, बेस्ट गिफ्ट किसी को देना है, कोलोनोस्कोपी का अपॉइंटमेंट करके गैस्ट्रोएंटरोलॉजिस्ट के पास भेज दो. इफ सपोज इन दैट फेज ही फाउंड टू बी प्री कैंसरस, गिठन सिर्फ है, उसको अगर कोलोनोस्कोपी से निकाल देते हैं, ऑलमोस्ट यू आर क्योर्ड. There is no chance that you will develop the cancer. So it is a one of the cancer which is preventable for your lifestyle modification by doing proper colonoscopy on time. It is a treatable because there are n number of treatment available from chemotherapy, radiotherapy, and surgery. Combination of treatment which can treat, and definitely if you diagnose in early stage, this is a one of the cancer in GI system. It is 100% curable.
Thank you, Dr. Samrat. We have a question about the colon cancer in the prevention part. How can we prevent the colon cancer?
We run last 3 years back when I was in the GEM Institute, we run the program called Happy Bowel and Healthy Bowel. How to keep your bowel happy? All diseases related to GI system, kaisa happy rakhna hai? So you eat proper timely, increase 30% of your diet as a fiber in the form of vegetable, fruits, nuts, sprouts. Increase your water intake in the form of at least 3.5 liter to 4 liter daily water intake hona hi hai. Or increase moderate activity in the form of cycling karo, yoga karo, jogging karo, any activity which make you sweat for a little bit. That is a good activity which will maintain your gut in healthy status. Avoid something called red meat or some addictive factors such as smoking. If you maintain that, it is highly possible that every GI problem can be preventable. But most of the patient need screening in the form of ultrasound. कोई भी दिक्कत हो रही है गट की, अगर 2 महीने में स्कैन नहीं किया है, डूइंग स्कैन डजंट हार्म. इट इज अ सिंपल टेस्ट which can detect bigger problem happening in future which can be prevented. If you are at the age of 50 के अराउंड में है, अगर कॉन्स्टिपेशन हो रहा है, पीआर ब्लीडिंग हो रहा है, कोलोनोस्कोपी कर दो, बिकॉज गिटन है, निकाल दिया तो you are 100% cured, because that swelling, that part will become cancer in next 5 years. We have prevented. These are the preventive measures can taken by anyone.
Yeah. So the next question for you, Dr. Samrat. What is the treatment option available and what is the best treatment for the colorectal cancer?
कोलोरेक्टल कैंसर बेस्ट ट्रीटमेंट नहीं होता है. कोलोरेक्टल कैंसर के लिए राइट अप्रोच रहता है. If we take a colorectal cancer, there are 3 modality of the treatment. There is something called chemotherapy. The chemotherapy का पर्पज ही है, अगर कैंसर हायर स्टेज में है, शरीर में जो फैला हुआ है, ब्लड में जो फैला हुआ है कैंसर, जो कि अगले 3 महीने में या 6 महीने में कैंसर बोल के सब तरफ मेटास्टेसिस स्टेज 4 में आने का जो चांसेस है, उसको कंट्रोल करने के लिए कीमोथेरेपी है. रेक्टम में पर्टिकुलरली अगर देखा जाए तो वहां पे बाजू बाजू में अगर चिपकने की पॉसिबिलिटी है हायर स्टेज में, उसको कंट्रोल करने के लिए रेडिएशन है. और सर्जरी इज वन ऑफ द मोडेलिटी. इट कैन बी डन इंडिपेंडेंटली. अर्ली स्टेज है सिर्फ सर्जरी कर सकते हैं. अगर लिटिल बिट हायर स्टेज है उसमें कीमो रेडियो दे के कॉम्बिनेशन में अपन उसको सर्जरी कर सकते हैं, जिनसे अपना क्योर मैक्सिमम पॉसिबिलिटी है. अगर अर्ली स्टेज है, प्री कैंसर स्टेज है, सर्जरी की कोई जरूरत ही नहीं है, कोलोनोस्कोपी करिए और निकाल दीजिए. दैट इज द एंड ऑफ द गेम. So modality of the treatment depends upon the patient condition, depend upon the health status, depend upon the stage of cancer, but combination of modality and making tailored approach for particular stage and patient is important. I would like to emphasize here, we are having tumor board. Any cancer in our hospital will not directly go for surgery, radiation, chemotherapy. We have a group of discussion of the people. We sit together, we defend as of it's my patient, I will defend that what is best. And all together we take a collective decision, so that when we take a collective decision, theoretically there is negligible chance that we will commit the error.